1 o'clock, and then not on the weekend, and then back Monday at 1 o'clock. As a reminder, if you'd like to have the emails updates on a daily basis, if that's easier for you, you can go to www.governor.ri.gov. There's a ability for you to sign up for a daily coronavirus update, and we will be happy to send you a daily update. I have heard from a lot of people that that's an excellent and efficient way to stay tuned in, so I'd encourage you to go ahead and do that. governor.ri.gov. Thank you again for tuning in. We'll begin, as we always do, with the data on the screen. It continues to be a good news picture for the state of Rhode Island. Sadly, there's another 22 deaths, bringing us to nearly 700 deaths in the state of Rhode Island since we've started this. But the good news is that hospitalizations and new cases are declining, and that's exactly what we want to see. That's a particularly good piece of news because we started reopening our economy on May 8th. So if any of the changes we've made, allowing outdoor dining, allowing people to go to the office, allowing retail, if any of that was going to create a problem in terms of virus spread, we'd be seeing that right now. And we're not seeing that right now. So if you're at home, I know a lot of you are still anxious, you're still nervous. I hope you breathe a sigh of relief hearing that from me, which means, you know, we're in really good shape here. You have to keep following the rules. We have to go slow and steady. But on Monday, it is my intention to begin on Monday, June 1st, with Phase 2. And you should feel confident that we're in a good place to be able to do that. We're not seeing any increases on account of the fact that we've reopened our parks, reopened a couple beaches, people are out and about more, and still we're holding steady. I want to ask you, if you haven't yet downloaded the Crush COVID RI app, please do that today. We've got just about 38,000 people who have downloaded the app. That is fantastic. We've only been at it for about a week. We're continuing to make improvements to the app. We also want to make it easier to use for folks that have older smartphones. But if you have a smartphone, if you haven't downloaded it, try to do it today. Do it during this press conference. It'll take you less than a minute. Google Play or the Apple Store, Crush COVID RI. Download it and use it. It's going to help us to stay ahead of the virus every step of the way. I want to say, the more we reopen the economy, the more important it is that we follow the rules. Wear your masks, use your app, track your symptoms, wash your hands, stay home if you're sick, stay 6 feet away from people. Okay, today there's going to be a lot going on the reopeningri.com website today. Next week on Monday, when we start Phase 2, there'll be many changes. We're going to be relaxing the rules around retail. More folks can go be in a store at any one time, allowing indoor dining, opening gyms, opening barbershops, salons, pretty much every area of the economy, except for large group gatherings, is going to start to reopen. So if you're a business, if you run a business, you own a business, or you just want to know what's going to be happening in your place of business, now is the time you want to be checking in on reopeningri.com. By the end of the day today, we will have everything posted for general business, retail, personal services, and indoor dining. Personal services include hairdressers, barbers, hair braiders, nail salons, tanning facilities, massage parlors, and tattoo parlors, and probably many other categories. So if you're interested in one of those, reopeningri.com. I want to take a few minutes today to preview for you what life might be like in a few of those venues. But again, the nitty-gritty details will be on that website by the end of the day. Okay, with respect to restaurants, we are going to be enabling indoor dining starting on Monday with Phase 2. At a restaurant, they're allowed to have up to 50% of their capacity. They must take reservations. By the way, with the reservation, the restaurant should not be asking for your address. It is just your name and your phone number that has come up, not your address. You don't need to provide that, just a name and a phone number. But you can't just, in phase 2, which is going to be essentially the month of June, you can't just show up at a restaurant. You have to call ahead, make a reservation. Self-service, salad bars, buffets, any other kind of self-service style food will not be allowed. Any kind of, like I said, salad bars or hot food bars, that won't be allowed. There'll be no standing service anywhere, including at bars, and standalone bars that don't serve food will not be allowed to open. Why is that? Because we have to make sure we don't allow congregation. So we have another Facebook town hall today, I believe at 4:30. There's a Facebook town hall today at 4:30 with restaurants. We had a call yesterday with the Hospitality Association. We want to get one last bit of feedback today at 4:30, and then right after that call, we'll put the final full details online. But everything is going to be geared around small groups, lots of space, mask wearing by employees and diners, reservations, limit on the party size, and no congregating at the bar. Personal services, same thing. Like, the good news is we can start to get back out again, get our hair done, get our nails done, do what we want to do. However, it's going to be different. It's going to look different, necessarily, particularly because the people doing the service are going to be very close to you. Now, so what is it going to look like when you go to get your hair done or the barber shop or to get your nails done or your hair braided? There are going to be capacity restrictions, maximum numbers of people allowed in the barber shop at any one time. You're going to be required to make a reservation. Same thing, give your phone number and your name. The use of waiting areas is going to be discouraged. We don't want you, normally, if you're used to going to the barber or going to the hairdresser and sitting down and reading a magazine, that's not going to happen. The magazines won't be there. We don't want people touching the same materials. So you should show up at the time of your appointment, get your hair done, and leave. We're not going to be allowing areas to congregate to wait for your appointment. If you show up, you're probably going to be asked to go wait in your car if they're not ready for you, or maybe wait outside. But and the same is going to be true at restaurants. The same is going to be true for lines at the bathroom, at a restaurant, or at a salon. We have to bear in mind 6 feet apart, wearing your masks at all time. Much more cleaning will take place. We've been in great contact with all small businesses around cleaning. We're trying to help these small businesses. Remember, there are the coupons available. You can go to Job Lot and use your coupon to get your free cleaning supplies. We're working with hairdressers to try to help them get supplies for them. So we're working very closely to make sure that businesses are open and available and able to do this. Businesses are going to retain your name and your phone number. Why? Because if there's an outbreak, the Department of Health needs to call everybody who's been in that establishment over a period of time. The person performing the service, the person cutting your hair, is obviously going to be close to you. Other than that, you have to stay 6 feet away from people, and you're going to have to keep your mask on while you're getting your nails or your hair done, and of course the person doing the service to you is also going to have to keep their mask on. Now, you may hear that and say, that sounds more like a hospital than a hair salon, and I get that. It's going to be very unusual. It's not going to be as fun and pleasurable as it normally is, but it's hopefully only a month. And it's going to allow us to get back out there and allow these hairdressers and barbers and restaurants to get back into business, and all the folks who work in those establishments to get back to work, which is what we're very focused on. Okay, yesterday we talked a little bit about youth sports, so I want to take a second to talk about that. I will say this. We've heard, before I talk about what we're going to do with youth sports, I want to take a second to talk to the kids out there. I have two of my own, and I'm somebody who played sports my whole life. I know this is really hard for you guys. I know distance learning is kind of a drag right now. We've been at it for too long. I hear from a lot of kids and parents and teachers that you're kind of down and you're really anxious to get back to life as normal. And I know that all summer programming has been turned upside down. And so I just want to say I'm sorry that we have to be living like this, and I know it's really tough for you. I also want you to know summer's going to be good. You're going to get to go to camp. You're going to get to go to the beach. You're going to get to go to the park. It's not going to be as same as last summer, but it's going to be a lot better. And I also want you to know if you're feeling down or you're feeling bad or you're feeling like you don't have energy, you don't feel like doing anything, you're not alone. It isn't you. It is not you. It's everybody. It's every kid out there is struggling a little bit because it's not normal to have to live inside of your house and not see your friends and not see your teachers and not play the sports that you love to play. So if you're feeling bad, know that it's going to get better. You're not alone. It's not you. It's the way we're living. It's really strange, and it's going to get better, and we're all going to hang tough a little longer until things get better. Because I have heard from a lot of you, and I know in my own life and my kids' life, that physical activity is very, very important. We want to enable some sports this summer. In a few weeks, school will be over. You've got to work hard, get through school, push it these last few weeks, do what your teachers say, finish the work. Just because the sun's not coming out, doesn't mean you can't do your work. But when you're done with school, we want you to get back out there. So starting in phase 2, which is Monday, June 1st, we're going to be allowing summer youth sports. But by the end of the day today, all the details will be on reopeningri.com. There'll be new guidance and safety precautions to keep kids, parents, and coaches safe. But in phase 2, youth sports can resume with stable groups of 15 kids or fewer. And this is consistent with the CDC guidance. We're asking you to keep your groups stable. So we will not, in phase 2, be allowing league sports or tournaments, because we don't want you seeing a different group of 15 kids every day, and we don't want you traveling all over the state. I hope that that will come in phase 3, which will be in July, but for now, we're going to ask you in phase 2 to focus on practices and scrimmages and games in stable groups of 15. I want to thank Director Janet Coit, who runs the Department of Environmental Management. She has been talking to parents, coaches, teachers, athletic directors, kids, in order to come up with this guidance. We are putting the CDC guidance on our website, so you can see that. The CDC is providing excellent guidance in this regard. They talk about low risk, medium risk, and high risk sports. And then we're going to have our guidance on reopeningri.com as well. But you can play ball sports. You can really play all sports with an emphasis on being outside, social distancing to the best of your abilities, excuse me, social distancing to the best of your abilities, stable groups of 15 or fewer, avoiding contact whenever possible, and then if you are using shared equipment, just being extra vigilant about washing that equipment. So I think, you know, and be careful. Bring your own food, bring your own water bottle. Don't be sharing food, don't be sharing water bottles. Adults and coaches should be wearing masks. and kids can wear masks as appropriate. If you need a hand getting additional equipment, please reach out to DEM. Janet Coit and her team at DEM have been all over this, and if you need help getting extra equipment so you don't have to share equipment, then call DEM and we'll give you a hand. Some of you may say, you know, but Governor, the kids haven't been that affected by the virus, and thank God that is true. From what we know so far, the virus hasn't hit kids at the same rate or with the same severity as adults. Having said that, kids are in contact with adults. Lots of them go home to grandparents, aunts and uncles, and parents who may be vulnerable, may be older, may have an underlying health condition. So although they ought to be safe, unfortunately there can be good spreaders of the disease. And by the way, they're coaches and parents. We have to keep them safe too. So I feel great about this because I'm anxious to see kids running around outside and playing soccer and playing baseball and playing sports, and I'm very hopeful that come the 1st of July, we're going to be able to allow some league sports and kind of tournament sports that I know you're used to. And I would encourage you all to do this, by the way. Get outside, play. It'll help you with your physical health, your mental health, and just help us get back to a sense of normalcy, which I think everybody needs and wants. Okay, today I said I would address the crushing problem of potential evictions and the fact that so many people are out of work and it's really, frankly, hard to pay the bills, including your rent. I said so many times, there's no question that this crisis has hit the hardest for those who could least afford to be hit. Anyone who went into the COVID crisis living in poverty, living paycheck to paycheck, being sick or having a health condition is really struggling now. And that is something that is foremost in my mind every minute of every day. And frankly, some people have said to me, Governor, you're going ahead of Massachusetts, ahead of Connecticut, getting people back to work. And that's true. I'm doing it because I know it's safe to do it. But frankly, we have got to get people back to work. Too many people have been out of work for too long, and we're compounding a public health crisis with this economic crisis. So for those of you who are in a difficult economic situation, and I know there are tens of thousands of you, help is on the way. We are pushing out our unemployment insurance checks. We are going to do our best to get you back to work as quickly as possible. And for those of you who are anxious about paying your rent, we want to do more to help. So 3 weeks ago, I announced a $1.5 million emergency rental assistance fund. I'm very pleased to say that fund has supported hundreds of families in need, but it was depleted quite quickly, and we couldn't really get to everyone who needed it. So today I'm announcing an additional $5 million into that fund. It'll be dispersed the same way as the first $1.5 million, and it'll be available starting tomorrow, an additional $5 million for rental assistance. It's for folks who qualify. They can receive up to $5,000 to support past due rent payments and other fees. If you want more information about that, if you're struggling to pay your bills because you're out of work due to the COVID crisis, you can go to housinghelpri.com, housinghelpri.com. We've started this a few weeks ago. Crossroads is helping us to administer it. Thank you to Crossroads. It's gone very smoothly, and we want to get more money out to help people. If you forget housinghelpri.com, just call 211. So if you're struggling to pay the rent, if you're worried about being evicted, if you're worried about being homeless, call 211, and there will be help available. Now, I want to say this won't be the last I have to say about rental assistance. The fact of the matter is this is a huge issue, and frankly, it's a complex issue. And so I would like to although what I'm announcing now, and I announced a few weeks ago, helps people today, right now, pay the bills, we need a bigger, more thoughtful solution, because there are going to be many people struggling to pay the rent in the months to come. So I want to make a couple of other announcements. The court opens June 1st. I mean, it has been open, but it will be open more fully on Monday, June 1st. The courts will begin to go through their backlog, including evictions. However, I have asked the court, and they've agreed, and they've assured me that they will not process any COVID-related evictions before July 1st. So I want to thank the courts for doing that. I believe it's the right thing to do. So what that means is they're going to be dealing, in the month of June, they will deal with evictions that started before March 17th. Before March 17th. So evictions that initiated prior to COVID, prior to March 17th, are going to begin to be heard starting next week. But if you lost your job since in the days after March 17th due to the COVID crisis, you do not have to worry about being evicted in the month of June. So you can call 211 and see if you're eligible for this relief. Otherwise, you do have essentially another month's reprieve, because you cannot, the courts won't process the eviction until at least July 1st. In the meantime, we're working hard with the courts, with the United Way, with other stakeholders to try to come up with a mediation initiative. You know, there are two sides of this equation, and we want to make sure that landlords get paid, right? They are running a business, and they have a stake in this also. So we are going to be working hard over the next couple of weeks with the United Way, with the courts, and with others to come up with an initiative where we can provide a mediated settlement, where we can help landlords get what's owed to them, but also, you know, put folks on like a longer-term payment program so that they don't get evicted, they don't wind up homeless, and we don't add to the economic suffering that we're already seeing so much of in Rhode Island right now. So I hope to be back to you probably the week after next with details on what that mediated solution would look like. Two more things. I want to take a second to talk about testing. So one of the ways that Rhode Island has really been a leader in dealing with the crisis is around testing. And I cannot emphasize enough how important this is. You know, I've been talking a lot about contact tracing, and that is important. That is so important. But testing is important too. We need to figure out quickly who is sick, who has the virus, get them into isolation, and then talk to everyone they came into contact with and get them tested. Actually, if you could do this perfectly, which you can't, but if you think about it, if you could be perfectly identifying who has the virus quickly, immediately, putting them in isolation, immediately isolating their contacts, you know, we would have a lot more leeway to reopen the economy safely. So that's why we have invested so much in putting together a really robust testing and contact tracing statewide infrastructure. And you should be proud of the fact and feel confident about the fact that at this point, Rhode Island leads the nation in testing. At this point, we've tested just over 14% of our population. That is by far the highest in America. No other state is at 14% of the population. A few are close to us, but you have many states that are at 4, 5, 6% of their population. That's a great thing. And that is also why I think we're able to be a little bit ahead of other states, and why people say to me, Governor, are you sure it's okay to go out to eat and go back to work? And I say yes. So the testing has been a critical component of this, and we're going to continue to ramp up our efforts. We want to be doing 10,000 tests a day by the middle of the summer, and closer to 15,000, 20,000 tests a day by the time school comes back. You know, we want to open school in the fall. We want to enable that. We want to do it safely, and so that's why we have to ramp up our testing. Having said that, testing is going to start to look a little different. So initially, we had a few drive-through tents around the state that did very high volume every day, and that's actually still what we have. So thank God for CVS. They set up the site at Twin River, capacity to do thousands every day. That's operating, and that's excellent. But over time, we want to ramp up our testing to 10 or 20,000 capacity a day, but not to have it be so dependent on these big drive-through high-volume centers, more so to have it integrated into the community and integrated into the healthcare system. And so that's where we've been going. Like with nursing homes, we're testing on site in high-affected areas, Pawtucket, Central Falls, Providence, Woonsocket. We go there. And we're also going to be rolling it out in your community and in your doctor's offices. So to that end, I want to announce today that starting tomorrow, CVS will be launching 10 new test sites at select CVS pharmacy drive-through locations all around the state. And again, I have to thank CVS for their partnership, their commitment, and their innovation. And it's no small feat to figure this out, right? We have to do it in a way where it's safe for the patient, but safe for the CVS employees. The logistics are complicated, so I want to thank CVS and my team for enabling this. The tests are by appointment only. Same thing as you would for Twin River. You go to cvs.com and make an appointment. You can schedule them online, cvs.com, same day. And then you go to the CVS pharmacy in your area where they send you, and you swab yourself in your car. So you go online, cvs.com, get an appointment or a time that you can go. You do the drive-through. CVS employee will hand you the kit. You swab yourself in your car. You hand back the kit, and you'll be notified of your results. Tests will be dropped in a secure bin outside of the CVS and sent to a lab for processing. Now, the difference between these tests and Twin River is that it's going to take 2 to 3 days before you get your results. So for most people, that's fine, because if you're having symptoms, you should need to be staying home anyway. So you get your test and you're staying home getting better anyway, you get your results within 2 to 3 days. It's not the rapid test. We are still going to have the CVS testing site at Twin River, which is you get your results in 10 minutes. So I wanted to preview where we are and where we're going, and also let you know about CVS. The last note for today, we have an election next Tuesday, June 2nd. It's our presidential primary election, and for the first time in our state's history, we're going to be having an election that is a predominantly mail ballot election. By now, everyone who's requested a mail ballot should have received that mail ballot. If for some reason you haven't, you should call the Secretary of State's office. 147,000 Rhode Islanders requested and have received mail ballots. That's fantastic. That's 20% of all registered voters, which for the first time we're doing this, considering everything else that's going on, I think is pretty fantastic. If you've received yours, send it in. Don't let it sit on the kitchen table. If you have it, I know you're busy, take a second, fill out your ballot, and pop it in the mail. The ballot comes with a prepaid return envelope. It needs to be received at the Board of Elections by 8 o'clock on June 2nd. So if you have your ballot at home, please go home, fill it out, and get it in the mail. If you forget to do it, and you wake up next Tuesday and you still have your ballot, there are going to be drop boxes at every city and town hall in the state, so you can drive by to your city or town hall and you can deposit your mail ballot then. Any questions about this, where city or town hall is, where you can vote in person if you haven't gotten your mail ballot. If you haven't received your mail ballot yet and you think you should have, you can go to vote.ri.gov. Secretary of State's doing a nice job, working hard to make sure this happens, and they'll be available to help you.